A 34-year-old woman presents to the emergency department with a 1-hour history of palpitations. An ECG is performed at triage, which shows a narrow complex tachycardia with a rate of 160 beats a minute. You diagnose a supraventricular tachycardia. There is no response to vagal maneuvers and you plan to give adenosine. What is the maximum total dose of adenosine recommended in the management of a regular narrow complex tachycardia? Options are A. 6 mg, B. 12 mg, C. 24 mg, D. 30 mg, E. 36 mg. The answer is 36 mg. The first step in treatment of regular narrow complex tachycardias is to attempt vagal maneuvers, carotid sinus massage or Valsalva maneuver. If the tachyarrhythmia persists, adenosine 6 mg IV should be given as a rapid bolus using a large cannula and a large vein. If there is no response, that is, no transient slowing or termination of the tachyarrhythmia, to adenosine 6 mg IV, a 12 mg IV bolus should be given, and if there is no response, one further 18 mg IV bolus given, max 36 mg, as per the 2021 ALS guidelines. Sequence of action in periarrest arrhythmias. Abside approach. Early ECG monitoring. Identification of adverse features. Intravenous access. Oxygen if hypoxia present. Immediate treatment of arrhythmia. No treatment needed. Simple clinical intervention, e.g. vagal maneuvers, percussion pacing. Pharmacological treatment. Electrical treatment, e.g. cardioversion, pacing. Subsequent monitoring and treatment. Continued ECG monitoring. Correction of reversible factors. Expert help and advice. A 78-year-old man presents to the emergency department with a history of syncope at rest. His family explain he has experienced multiple similar episodes in the past and was referred for a 24 ECG recording and an echocardiogram. You check his echocardiogram report and it shows mitral stenosis. Which of the following is not a typical feature of mitral stenosis? Options are A. Mid-diastolic murmur, B. A low volume pulse, C. A loud second heart sound, D. Tapping apex, E. Malar flush. Answer is C. Loud second heart sound. Clinical features of mitral stenosis. Symptoms: exertional breathlessness, orthopnea, PND, pulmonary edema, atrial fibrillation, hemoptysis, fatigue, pulse, small volume, irregular, usually AF, cardiac impulse, tapping apex due to palpable first heart sound, auscultation, loud first heart sound in sinus rhythm, opening snap and rumbling mid-diastolic, murmur heard loudest over apex, early diastolic murmur of pulmonary regurgitation may occur, Graham-Steele murmur. Other features: mitral facies, pink-purple patches on the cheeks reflecting reduced cardiac output and vasoconstriction. A 73-year-old woman is brought to the emergency department by her family. She complains of dizziness that started 2 hours ago. On examination, she is found to be bradycardic with a heart rate of 42 beats per minute. She has an episode of syncope with a blood pressure of 72/54 mmHg. What is the recommended treatment for this patient? Options are A. Adenosine 6 mg, B. Atropine 500 micrograms, C. Amiodarone 300 mg, D. Transcutaneous pacing, E. Adrenaline 100 micrograms. Answer is B. Atropine 500 micrograms. The patient is bradycardic with adverse features, syncope and shock. For patients with adverse features, Give atropine 500 micrograms 4 and if necessary, repeat every 3 to 5 minutes to a total of 3 milligrams. If bradycardia with adverse features persists despite atropine, consider cardiac pacing. If pacing cannot be achieved promptly, consider the use of second-line drugs. Seek expert help too. Select the most appropriate choice, e.g. glucagon, aminophylline, isoprenaline, adrenaline, dopamine, glycopyrrolate. The patient is bradycardic with adverse features, syncope and shock.